President Joe Biden and his team repeatedly promised more COVID-19 testing, including at-home kits that deliver rapid results, but they are now admitting a virus that is more adaptable than the politicians who fight it has outpaced them again. For many Americans, this holiday season may be remembered for hours spent in long testing lines or fruitlessly searching pharmacy shelves for antigen tests as the Omicron variant took over the previous Delta wave. Already patchy testing has been exposed by the latest highly transmissible variant, and the US is being compared unfavorably to other developed nations where citizens have easy access to rapid tests for free. Biden told governors in a virtual meeting Monday that his administration should have done more to speed up the availability of rapid testing before his pledge this month for 500 million kits due to begin distribution in January, which will be too late to help this week's holiday crunch. It's not enough. It's clearly not enough. If we'd have known, we'd have gone harder, quicker if we could have, the president said, referring to the Omicron storm that has quickly overwhelmed existing testing capacity. In an interview with ABC News just before Christmas, Biden denied that shortfall in at-home testing represented a failure. But he added, "You could argue that we should have known a year ago, 6 months ago, 2 months ago, a month ago." The president said he wished he had thought about ordering 500 million at-home tests 2 months ago. Such comments by the president, while candid, are unlikely to improve public confidence in a White House that vowed to shut COVID-19 down but sometimes seems to have underestimated the staying power of the virus and the scale of the challenge. The administration has had some important successes in fighting the emergency despite the politically motivated reluctance of millions of Americans to take the president's advice on the vaccines that could save their lives. And on Monday, the U.S. Centers for Disease Control and Prevention changed its guidance in a way that may make the current outbreak less disruptive to everyday life, shortening the recommended times that people should isolate when they've tested positive for COVID-19 from 10 days to 5 days if they don't have symptoms and if they wear a mask around others for at least 5 more days. But not for the first time, when it comes to testing, the White House is being forced to play catch-up following successive waves of a pandemic uncannily able to exploit political divides, slow-moving bureaucracy and the impatience and weariness of the public with a crisis soon to enter its 3rd year. The frustrating search for tests endured by many Americans may also have a political consequence for Biden as he searches for a bounce back after a grim few months that saw his approval ratings tumble. He is, after all, on the record promising to fix a dearth of testing that has been laid bare by the recent viral surge. Running on competence, he put the issue at the center of his 2020 campaign, which was partly rooted in highlighting ex-President Donald Trump's failures during the first year of the pandemic. And in an address to the nation last March, for instance, the president said, "We continue to work on making at-home testing available." More than 9 months later, he is now admitting not enough has been done. Such comments make it hard to accept arguments that the White House was taken off guard by the Omicron variant. Many experts have said for months that rapid testing needs to be more available to the public. It's hardly a secret that new variants of the virus were inevitable. And a recent episode in which White House Press Secretary Jen Psaki mocked the idea of sending a test to all Americans, a goal Biden has now embraced, further muddled the administration's stance on this new phase of the pandemic. The confusion has frustrated some public health professionals who say there simply aren't enough kits to permit people who are sick, those exposed to someone who has been infected with the virus, and people who want to travel and attend gatherings to get tested. It really is shameful that we don't have the amount of tests that are necessary to be able to use it as the robust containment tool that we know it is when used effectively, Dr. Chris Purnell, a public health physician and fellow of the American College of Preventive Medicine, told CNN's Allison Camerota on Monday. All of this may give credence to midterm election messaging from Republicans that Biden has failed in his self-appointed #1 task, beating the virus, even though it's the GOP's repeated attempts to politicize the struggle that have often set back the pandemic response. The party's continuing devotion to Trump, who once urged public health officials to do less testing so they would uncover fewer COVID-19 cases, also casts doubt on its sincerity on